When a Native Hawaiian elder said, "I don't feel seen when I'm here," it revealed what public health data never could. In this conversation, three public health professionals join me to explore how listening to communities transforms end-of-life planning, clinical outcomes, and youth mental health. Tune in to hear why listening comes first, how care becomes our most powerful public health tool, and what happens when communities define public health for themselves. You're listening to the PHEC podcast, episode 445. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guests and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and also trainings, ultimately helping our clients communicate their health information in plain language to the community partners as well as the broader communities that they serve. The support we provide often falls in categories of strategic planning and sometimes capacity building. Please reach out to us at drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will also be provided in the show notes. I am excited to introduce you to our guests for this episode, and that's plural, so we have several of them this time. What happens when you ask communities to define public health for themselves? This is a What is Public Health series. If you've been following our podcast for a while, you're familiar with that. It's a series of conversations, and here we're bringing together perspectives from end-of-life care, health informatics, and indigenous health research, as well as youth mental health. From diabetes appointments in Hawaii to advancing care planning in Chicago to mental health support in Baltimore. These stories explore how public health shows up when we center community voices, build trust before programs, and recognize that care work, the work of caring, has always been public health work, even when systems don't acknowledge it. Joining me are Kandis Draw, a senior community health worker at the HAP Foundation, specializing in end-of-life education for Black communities. Also, Nina Lopez, a health informatics researcher pursuing her doctorate while focusing on bioinformatics, predictive analytics, and Native Hawaiian health outcomes. And Dr. Augustina Mensa-Kwao, a postdoctoral researcher at Johns Hopkins Bloomberg School of Public Health, studying how urban environments affect youth mental health. Together, they reveal what happens when we listen deeply, consult community councils before implementing programs, and honor the collective care that sustains communities. Let's connect our conversation right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Welcome, everyone. This is an exciting time for our What is Public Health series. We started this series just a little while ago for the purpose of just helping us to practice our storytelling and how we explain public health to our friends, family, just keeping it conversational. The only rule is no jargon. And then holding space on the podcast to share these types of conversations, to foster more conversations, also to give us kind of a pool, a library, a way to kind of go back and listen to other folks. I think the more I do this, the more I'm realizing that there will never be a repeat. I'm asking the same question, but because this is such a dynamic field and we all have different perspectives, the responses are always different. So I'm very much excited and looking forward to our conversation. We'll start with a round of introductions. So we'll not really a exact order. I'm just going to start kind of moving around the screen as you guys are presented on my screen. And so I'll start with Kandis and just ask you to just, well, welcome to the series, but just take a moment to introduce yourself.
Thank you. Hi, Charlotte. Hi, Tina. Hi, Nina. So my name is Kandis Draw, and I live in Chicago. I am a senior community health worker for the HAP Foundation. HAP stands for Hospice and Palliative. We focus our work on workforce development, research, advocacy, and community education around end-of-life issues and serious illness for adults and children. I have been a community health worker for going on 5 years now, so I work in the end-of-life space. I am also a master's degree student at Loyola University Chicago, where I will be graduating in May with my master's in public service leadership. So it's good to be here.
I'm very excited for you. And for our regular listeners of the podcast, be thinking that she sounds familiar. That's because she was a guest on the podcast. So we'll have to make sure that we provide a link to that episode so that you can review or go back to that. Thank you for being here, Kandis. Really appreciate it. Next, we have Nina. Nina, I'm excited to have you join us. Please introduce yourself.
Hi, everybody. It's such a pleasure to be here. My name is Nina Lopez. I am a new resident of the Washington, D.C. area after recently moving from Hawaii, Honolulu specifically, if anybody is familiar. My background is in health informatics and epidemiology, which is what my Master's of Public Health is in. And at the moment, I'm also pursuing a doctorate in health informatics, so DHI for short, where I am currently focusing on bioinformatics, predictive analytics, and all of that really fun data analytic heavy technical stuff. A lot of my work sits at the intersection of clinical outcomes, social determinants of health, and population health, and leveraging clinical data and sometimes claims data as well to understand where the current population stands. And a big passion of mine, particularly to focus on that, is Indigenous health, particularly Native Hawaiian health.
So excited to have you join us. You're from one of my favorite places. So when we visited Hawaii, it was the Big Island, but I'm low-key obsessed. Also excited to have you here. A lot of the work I do as a consultant serves the tribal nations and also aligned with the population that you care so much about. So thank you for being here. Let's hand over the mic to Tina. It's so great to have you here.
I am so excited to be here. Thank you so much for having me. And I'm excited to be in this conversation with Kandis and Nina. So I recently graduated with my PhD 2 months ago from Johns Hopkins Bloomberg School of Public Health, where I'm also currently a postdoctoral student in the Department of Mental Health. My research focuses on trying to really help youth mental health globally and locally here in Baltimore. And so I focus on how does the urban environment affect young people's mental health, and what can we do as people who do public health work to intervene and make sure that we are taking care of young people before they experience any kind of mental health illness. And so I'm excited to be part of the conversation and look forward to it.
Awesome. Awesome. Thank you so much for being here. We met back in the middle of the summer at Policy Action Institute. So it's really nice to stay in touch and to seen you recently at the conference and to have you on this panel. So this is wonderful. All of you are phenomenal, and I'm excited for this round of conversation. So my question is really around answering what is public health? That's the name of the series. So really what I'm wondering is, how do you explain public health through the lens in which you work or specialize in to your friends, neighbors, family members? So we want to use plain language. Feel free to interject any personal stories or any stories that you use, examples that help them to understand what you do, or however you present it. The only rule is that there's no jargon, no textbook definitions or explanations. We want this to be this: how are you explaining it? How are you having the conversation? So feel free to present it, respond any way that you like. We're going to go kind of in the same order, give you each a chance to respond, and then we'll bounce back based on your responses. So we'll start with you, Candace.
So when someone asks me what I do, I'm like, what in the public health space, I always say that I work in end of life care. Well, that's pretty broad. So what specifically do you do in end of life care? So for me, my focus is really, really on educating our Black community about what end of life is, what it looks like, and what are the differences between hospice and palliative care. And really, a lot of our community members don't really know what the differences are. And then whenever I do research, it's always community based because I believe that the community members have a bigger knowledge of what it is that they need at a bigger level, and that hospitals and institutions need to hear and understand that. So even though we work with academic partners and all of that, I try to always make sure that the community is front facing in whatever that I do. And it that brings serious issues with me. And it has. But I think that what community health workers do in general, it's not just educating community, but it's centering community in what you do, understanding community needs, and building relationships. Yes, end of life is a public health issue because everyone deserves to die with dignity. Everybody deserves to die with respect. And that's a large part of the work that I do.
Thank you for the work that you do. At any point, do you actually connect it back to the meaning of public health? Like when you're explaining end of life care and you're educating, is there ever a point where you're saying this is an example of public health? Just curious.
Yes, I have. I have said that. But it's not something that you think that's public health
Right.
because it's such a unique space. Like we don't consider planning for our end of life that big of a public health issue. It can be tedious, it can be monotonous, something that people just don't think to do or have to do it and it's tedious. So for me, I think it's connecting it all back to public health. Yes, end of life, serious illness, those are public health issues. But it's important to be informed. It's important to be consistent and to understand what your options are, how you can make your end of life better, fighting a serious illness, but also connecting you with resources. So working on the whole of a person and not just focusing on what the illness is specifically.
Nice, nice. You're definitely a unique space, but I like that you are connecting the dots for people. What about you, Nina? Same question. Give you an opportunity to explain how are you answering that question for people, friends, family, in a way that doesn't use jargon.
I love this question so much because it makes me go beyond what we see public health as in a conventional manner, but think of it in a more deeper and on a more deeper level and something that's bigger than all of us. And this is also a reminder of me to go and ask my friends what they think I do because I want to know if they can explain it to me despite their years of supporting me through this. So that'll be a test of my own knowledge as well as if I think I am explaining it appropriately. So, when I first started off in my career, I've always primarily worked in the private industry, and I very quickly learned that using big technical words and jargon and so forth, it's just simply not going to cut it. When you are in a healthcare setting, specifically and primarily of the individuals you're working with are clinicians, so they aren't trained epidemiologists, or if you're working with social workers, they are trained to speak to someone maybe with a little less nonviolent communication, as what someone might describe the way that I talked before, as well as oftentimes people who their backgrounds are also maybe they're an MBA or they primarily work in administration. And so they don't care what an odds ratio is. They just want you to tell them what is going on and to do it efficiently and quickly and something that is understandable. And so, yes, what most people think of public health as being data or vaccines or the commercials telling you to wash your hands, those are all part of it. But what I have intricately learned throughout my journey is that public health is far more human than what any of us really stop to pause and think about. And it's far more simple than what's the new variant of COVID-19 at the moment. But so to me, what public health is, it's what happens when the people are able to gather to define what public health means for themselves. It's not something that's paternalistic that we tell them what public health is. It's when we allow the community members of who we are serving to define what public health is for them. So, I'd like to share a quick story. A few years ago, I was working with a primary care clinic that served diabetic Native Hawaiian patients, and we were really trying to focus in and understand why the no show cancellation rates were so high for this specific population. Like, yes, we had the vague reasons that the electronic health record told us, and we could see somewhat of a trend, but not really. And it was the quantitative, the numeric part of the data didn't tell the full story. We held focus groups, and something very moving happened. One of the kupunas, which is a little Hawaii word for an elder, she said, "It's not that I don't care about my health, it's that I don't feel seen when I'm here." And then another patient said along the lines of, "You want me to show up on time, but when I walk in, no one knows my name and I don't feel like I belong here." Another person said, and this one really stuck with me as well, "I'm not just a diabetic. I'm a grandmother. I'm someone who still dances hula. I'm someone who loves life. And so why isn't my care reflecting in that?" And then it was in that moment where it really clicked for me that health is beyond the blood pressure readings that I study in my Excel spreadsheets, and it's beyond the lab reports that we see telling us what someone's blood sugar is or whatever that we can put up on a fancy PowerPoint for somebody to look at. And that health is really essentially it's the story of belonging, and it's trust, and it's happiness, and it's having a place in our community where we can feel respected and understood, rather that be by our doctor or our neighbor or our policymakers and our teachers and so forth. And those are things that we cannot measure in lab values. We can probably not ever quantify those things. And I think that's a good thing because it shows that we are far more human than just a number on a piece of paper or on a PowerPoint that's been aggregated to present to a conference, for instance. And so I think that's what public health is. It's the space where people get to define what thriving looks like for them. And I think for us working in public health, it's our job to listen and to believe them, and then to build systems that then match their definition and not force our version of what public health is that we learned in graduate school onto them. And then I also think about the communities that I serve. And then I'm reminded that particularly that indigenous knowledge is such a gift to us, and that public health is holistic because the people are holistic. And we have a community that doesn't separate mental health from physical health or spirituality from food or joy from survival, then we can really see a community that comes together to thrive as one, and they all move together as one.
You did a whole masterclass just now. Just saying that is phenomenal. It really makes me think about the definition of health that I embrace, which is the WHO's definition. Health is not just the absence of disease, but it really encompasses, our mental, spiritual, emotional well-being and everything you're describing, that holistic approach. Absolutely love that. I'm going to refrain from going too much further right now, but thank you for that, Nina. Tina, same for you. Same question.
Nina, I love what you just said. Absolutely amazing. When I think about public health is exactly that, about people feeling respected, being understood. It really is about our humanity. And I love what you said about it's about communities coming together to thrive as one. And so when we think about public health, I really think about it as public and health. So when we think about public, for me, that's anything that's available to everyone, right? And so everyone should have access to it. And then health, we're thinking about holistically, not just physical, mental, spiritual, emotional, the whole entire person. So public health for me is just thinking about what can we do as a community of one to keep people healthy in all different aspects of who they are. And so that really helps me think about our role as working in public health. And it's about stopping problems before they show up. And so when I know when public health is doing a good job, most people don't notice because we've already stopped the issue from happening altogether. It's like when you get a text message from a friend and they're like, "Hey, I think you should Uber after a long night of being out instead of getting in your car." That is an act of public health. Each and every one of us are playing a role in keeping the people in our communities healthy. And you might not even know it, but you definitely are. When I think about my work specifically in mental health, oftentimes people separate the brain from the body. and it's all connected. Your mental health is part of your physical health. And I work with young people a lot. And so when I say mental health, a lot of them are like, what's that? And then I'm like, okay, it's about how you think, feel, and behave. When we really, really bring it down to the surface level and think about mental health, we're really thinking about how do we better improve our lives so we can function to the best of our ability every single day. And oftentimes people don't understand that mental health issues can manifest physically, right? You can have a stomach ache or you can have a headache, and you may just be having a rough day. It makes me think about some of the work that I did in Haiti where mental health didn't translate at all. And so we asked the community, so when you're feeling stressed, what do you feel? So when I think about mental health, I can also think about people feeling stressed and how that looks like in different communities and different spaces, and asking what they do to de-stress. It could be like taking a walk, listening to your favorite song, eating a good meal, talking to a friend. We know that community is about coming together and public health is about working together. And so as public health people talking about public health and working in public health, we really need to be involving people in everything that we do from the start, because communities do have the answers and we're just here to help facilitate.
That was amazing. I love that. Especially, I made a little note of that Uber example of public health. Those little examples and being able to explain to people in a way like that, that is really relatable, is really great. I'm going to have to remember that one. I'll give you credit, of course. Amazing responses. And there's some themes that are starting to surface as I'm listening to. Each of you really have a passion for community, especially the communities that you each serve. And you're being public health right in front of them. So in different ways, you're helping the community connect the dots. Like there's this overwhelming presence of an awareness of what you're doing as public health, but you're finding ways to connect the dots for them, and you're letting them lead the way, and you're very aware of their needs. And that's exactly how we should be. Some of us in public health are more connected to the community directly than others, like people who are maybe a little bit more removed from the direct community may have to find ways to reconnect, because I think that is like a direct energy line, a direct source, and it keeps you very humble and relatable and aware and really flexible and nimble, because when things shift in the community, you're going to feel it first if you're really connected to the community. So I'm just going to go back around and give each of you a chance to kind of respond. Any thoughts based on, Kandis, you went first. So then after hearing the conversation, what kind of thoughts are coming up for you, or questions, or, just adding to?
I have to say that I think that when it comes to community and care, I think that the time right now where I think those are going to be the only two things to really rely on, because I see that systems and things that I think that were guaranteed at one point are no longer, as strong as they once were, or even in some cases about to be taken away. And I think that when it comes to food insecurity, housing, when it comes to different things like that, those are all public health issues. It also is going to require a lot of community work. It's going to require you pulling from resources. It's going to require collective effort from clergy leaders, from other community-based organizations to help address some of the needs that we're seeing. Also, now healthcare is under attack, Medicaid. Like there's so many different deep things that are happening. And I think that the only solution for that is community and care. I think that, we layoffs and different things. I mean, all of these are issues that are going to affect you mentally, emotionally, and public health focuses on the entirety of a person. And I really don't think that you can have community relationships unless you focus on, well, you need to build relationships, but you have to, more importantly, meet a need. You have to, continue to form those community bonds. But if public health is going to continue in the future, it's going to require a collective effort from everyone. And most of that is going to be just centering yourself as a person and understanding that what connected us all in the beginning was that we came together for a common focus, but what's better more than the common good of a community. And, even in the work that I do when it comes to like advanced directives, we use one called the five wishes, but the five wishes is one that focuses on the entirety of a person, how I want to be treated, what I want my loved ones to know, how do I want to be at the end of my life, things like that. That's also focusing on the whole of a person and making sure that they have the best quality of life possible. And again, that's public health. I hope that as we continue to go on that, business leaders and people, continue to see that because that's kind of where we are right now.
100% agree with you on that. I think historically, I can speak to the Black community and what I know of communities of color because that's where I've served the most in my consulting work. Historically, we've been well cared for despite all of the racism and all the negative things that have happened in these communities. We've been loved and cared for by our community, our family, our friends, and we provide and we support. And that's just how we show up. So I think as we show up, like now what you're describing, Candace, I think it's important that we do this and we keep pointing to this is public health because that emphasizes the need, connecting the dots for people, like you said, corporations, industries that we intersect with as we're serving our communities, then they understand, oh, this is public health. And it points to the need to fund public health so that what we're doing can be amplified and more of that can continue in the future for this new version of whatever Public Health 2.0 looks like. I'm going to give you a chance, Nina, because I don't want to talk too much, but give you a chance to kind of, respond, share your thoughts as well.
Thank you. And I love that we all, it seems, I don't know if Charlotte planned this, but we all came to this discussion discussing community and the power of community. And I love that. And I think that speaks to it. And one thing that I thought of from Candace and Tina is the discussion of consulting community, right? Because that's often so overlooked. And one thing that I learned from observation and then eventually participation and leadership was watching how in Hawaii, and then I later learned as well, they do this as well in other indigenous populations, is there are formal community councils. So if somebody wants to do research or implement a community program, you have to go to the community council first. You can't just say, hey, I'm going to go knock on doors and talk to people. I mean, technically you can, but no one's going to be nice to you most likely, or they're going to reject you. And I just think that goes to show how we as community members, because yes, we're also public health workers, but we're also part of these communities, that we have so much power than what we think, and that our power is within our ability to organize and to speak up for ourselves and elevate our voices and the voices of our neighbors and, those who are more vulnerable than us as well.
Yes, absolutely. Thank you for adding to. And no, I never know exactly what will emerge. I invite all of you very, intuitively, I know that I want to have this conversation, but how you guys show up at the table, I'm always just excited to see what emerges and what the themes are going to be. So that part just organically comes together. So I love that. Okay, Tina, for you, give you a moment to share your thoughts, any questions, anything that's coming up for you.
Love, love, love the conversation. And the two things that I'm resonating with most, that's coming up for me the most in this conversation, is care and community. So, what does care look like? That looks different to everyone. And what does community look like? And that also looks different to everyone. And so, going back to something Nina mentioned earlier, it's so very important to listen to each other. We don't have all the answers. And oftentimes, people know what works for them. So we need to listen. If there's anything we can do better in this day and age, is taking the time to listen to each other, listen to our stories, listen to what works for people, because we don't have the answers. And I think the answers can only be found in community by listening, by actually respecting what people have to say and elevating that in all the spaces, whether that is in our local community, in policy spaces, in media spaces. We have to be intentional about it.
I absolutely agree. Ladies, thank you so much for making time to join this conversation, for sharing your heart and your stories and your views. This has been amazing, very inspiring. I know for myself, for sure for me, if nobody else gets anything out of it, I've been touched. But I know our podcast audience is really pulling from this and really feeding off of this. So thank you all. I appreciate all that you do. I appreciate this community, and I look forward to keeping in touch with you all and maybe I'll bring you back again for like round 2. Thank you so much. I really hope you enjoyed that conversation as much as we did. This conversation reveals what textbooks often miss. Public health thrives when we recognize communities as experts in their own lives. Whether it's understanding why patients miss appointments, ensuring dignity in end-of-life planning, or supporting young people's mental health, the work begins with listening and believing what we hear. These 3 professionals remind us that the Uber text from a friend, the community council that protects research integrity, and the relationships we build before implementing programs aren't separate from public health. They are public health. Your commitment to community connection isn't extra work. It's the foundation of everything that follows. I encourage you to connect with my guests and learn more about the great work that they're doing in public health. You can find links to connect with them on the show notes page. The show notes page for this episode, which is episode 445, can be found at phecpodcast.com. Once you're there, just navigate to episode 445 to find the show notes. One more thing before we go. Remember that our podcast has an app and a private community. It is independent of social media platforms, so you don't have to go into Facebook or any other platform to access it. It is our private community. It is where you can engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes just like this one. You can download the PHEC Podcast Community app in your mobile app store, and it is available to both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.